My name is Kent Meredith, and I'm an interventional cardiologist at the Utah Heart Clinic with Intermountain Medical Group. An interventional cardiologist is often referred to as the plumbers of cardiology. So we take care of blocked vessels. We go in with balloons and stents, and we try to blow up the balloon and dilate the artery and try to push the plaque out of the way, and then we put a stent in. You start with a blockage in the vessel, and when you're done, if everything works out right, you have a nice smooth pipeline. I did my undergraduate at Brigham Young in Provo, and then from there went to the Medical College of Ohio in Northwest Ohio and got my medical degree. From Ohio, I moved to Tucson, Arizona, went to the University of Arizona for internal medicine, and I also stayed there and did the chief residency, and after that went to Washington University in St. Louis. For the last 2 years, I transferred to the University of Utah and did my Interventional Cardiology Fellowship, which is where you learn to use the stents and the balloons. I think when I was a medical student, I had kind of an affinity to that area. I remember when we were in the gross anatomy course dissecting a cadaver for the first time. One section that I really enjoyed was when we dissected structures. It just, everything clicked at that moment, and that just seemed to be my calling. Every other course through medical school we had, if it involved the heart, that was where I had the most interest and enthusiasm. I would like my patients to know that I will always give them 100% of my time and attention when I'm taking care of their problem. I will take the time needed to answer a patient's question. I'll try to explain everything so they understand what the process is as much as I can. Obviously, if you have to run and take care of emergencies, sometimes you have to postpone those things. Well, my particular interest is in the treatment of acute heart attacks, particularly the ST elevation myocardial infarction, or STEMI type of heart attack. That is the most urgent, critical type of heart attack, and when it happens, you really have to be everything has to click into place immediately. Every minute counts. I'm pretty confident, and I've worked in other healthcare facilities here in Utah and across the country. It's the most advanced, up-to-date, and I think the systems we have in place here that really make it hard to not give a patient the best care. It almost becomes automatic to make sure every detail is in place when you're taking care of patients.